Good evening, and welcome to an AARP special, COVID-19’s Onslaught on Latino Communities. I'm your host, Dominic Dezzutti. We've gathered an excellent panel of experts to look at how the COVID-19 crisis has had a disproportionate effect on the Latino community in Colorado and beyond. We are also going to highlight the important steps that governments, community organizations, and community residents can all take to reduce the impact of the pandemic. This program hopes to shine a light on current conditions and what we can all do in our communities to help our state recover. Allow me to introduce our esteemed panel. Roberto Rey, the Associate State Director for Multicultural Outreach for AARP Colorado. Emelyn Martinez, the Chief Medical Officer for Valley-Wide Health Systems. Jonathan Alcanta, an Assistant Professor for Mexican American Studies at the University of Northern Colorado. Jasmine Ramirez, the Manager of Leadership Programs at Voces Unidas, and Dr. Bill Berman, Director of Denver Public Health. Before we begin, it would be a good idea to set the stage to find out exactly where we're at and how we got to here, looking at the current state of affairs. Let's take a look.
In July, the World Health Organization announced that almost 700,000 people have died of COVID-19 since the global pandemic exploded in early 2020. About 20% of those deaths occurred in the United States alone, even though the U.S. only makes up 4% of the world's population. Today, we are going to take a look at one microcosm of the pandemic, its disproportionate impacts, and communities' responses to it. We are going to explore how and why COVID-19 is disproportionately impacting Latinos in Colorado. We will also discuss how the virus is impacting older adults. Let's start by putting this all in context. First, what do we mean when we say Latino? For our purposes, we'll go with a commonly used definition that Latino means anyone in the United States who has cultural ties to Central and South America, or people in the Southwest descendant from Spanish settlements, before Colorado was even Colorado. Colorado has a rich Latino history. For example, in the 1960s, the Chicano rights movement took root here, eventually evolving in the political powerhouse that got Federico Peña elected as Denver's mayor and Ken Salazar elected as Colorado's U.S. Senator. Sadly, Colorado also has a history of anti-Latino movements. In 2006, both Democrats and Republicans in the Colorado legislature voted to deny immigrants, with a public emphasis on Latino immigrants, access to government resources that the immigrants' own tax dollars paid for. Derogatory statements regarding Latino immigrants from the White House are well documented. In Colorado, certain elected leaders have held public events with members of anti-immigrant hate groups. This is the context in which COVID-19 has hit Colorado. Perhaps then it is no surprise that Latinos have been disproportionately hurt by the virus and/or not optimally helped by the response to it. But let's take a dive into the data to get a detailed picture of exactly what is going on. Latinos make up 20% of Colorado's total population, but make up 38% of Colorado's COVID cases. The disproportionality is more pronounced in Denver. Latinos make up 30% of Denver's population, but they make up almost 55% of its COVID cases and 50% of its COVID hospitalizations. Other demographics in Colorado, including Native Americans, Asians, and Black people, are also disproportionately infected by COVID, but not nearly at the rate of the Latino population. In comparison, non-Hispanic white people make up about 55% of Denver's population, but only 30% of its COVID cases and 27% of hospitalizations. For Denver and the whole state of Colorado, the rate of death from COVID holds pretty even between Latinos and non-Hispanic white people.
The context for COVID-19 contributing to high percentages of disparity in hospital rates as well as deaths for our Latinx community, I want to start first with understanding how we got there. And so we want to understand how systemic racism contributes to the health disparities by way of not creating and providing healthcare access. And so we also know that systemic racism contributes to the type of positions that you work in. And so If you're an essential worker, we have to ask ourselves, why is it that our Latinx folks are working in positions to where they don't have the ability to be able to not work virtually? And so these are all connection points to systems of inequity. And so I want to make sure that we're looking at the pervasive disparity with COVID-19 in the context of how systemic racism creates the disparity. It creates the inequity in the lived environment. It creates the career choicing as essential workers. So these are all things that I want to make sure that we connect the dots as we're talking about the disparity with COVID-19. Let us not forget that it comes in the context of systemic racism.
So to sum it up, Latinos are more likely than non-Hispanic white people to get infected by COVID-19 and are more likely than non-Hispanic white people to be hospitalized because of COVID. But at least at this point, Latinos aren't necessarily more likely than non-Hispanic white people to die if they get COVID. While we can't draw definite conclusions about this limited data, we can search out some narratives that are corroborated by decades of studies and reports. First, Latinos are more likely than non-Hispanic white people to work in environments that foster infection. The infections at meatpacking plants are a sad example of this. A main route of COVID-19 infections is droplets. The meat and chemicals involved in meatpacking produce a lot of droplets that the virus can use as transportation from one person to another. Several global experts also believe that the virus can be transmitted in an airborne fashion, meaning that the virus can float in the air and circulate. Meatpacking plants' ventilation systems are made to keep outdoor particles out of the circulation to keep meat from spoiling. But this same system may be helping keep COVID-19 viruses alive and circulating. But risk of infection is not just about physical infrastructure. It is also about employees' power in the workplace to ensure a safe environment. Latinos and immigrants at meatpacking plants do not often have this power. Given some of the current rhetoric and enforcement tactics towards immigrants without proper paperwork, immigrants are often forced into silence. Employee contracts often have forced arbitration clauses in them, so workers cannot access the courts or really any type of fair processes to address workplace problems. After the outbreaks at meatpacking plants, President Trump went as far as to sign an executive order to insist meatpacking plants stay open and functioning at full capacity, with governors and mayors being overruled if need be. Now there is a push by the U.S. Senate Majority Leader to pass legislation that would greatly limit employers' liability for the spread of COVID at the workplace. Latinos have historically faced a political and economic power imbalance in having a say in the safety standards of their workplace. And right now, there is little doubt that that imbalance is contributing to the disproportionate rate of COVID infections. Another factor in the disproportionate impact of COVID on the Latino community is the disproportionate incarceration of Latinos, not just for alleged criminal offenses, but for civil immigration offenses too. For example, the immigration detention facility in Aurora has been officially labeled by the state as an ongoing outbreak site since May, with at least 18 detainees testing positive along with 6 staff members. In terms of criminal detention, Latinos make up 20% of Colorado's population, but make up about 30% of its arrestees. Of the top 15 outbreak spots in Colorado, 5 of them are jails and prisons. The disproportionate incarceration of Latinos and other minorities resulting from inequities in the criminal justice system are one source of the disproportionate harms they now face from COVID-19. Lack of health insurance and access to health care is also a likely factor in the disproportionate impact of COVID on the Latino population. Under Colorado's implementation of the Affordable Care Act, the number of Latinos without health insurance dropped from 30% to 10%. This was a huge success, but at 10%, Latinos are still the least covered racial or ethnic group in Colorado. Also, over the past 2 years, Latino children have actually lost insurance coverage, with the uninsured rate of Latino children in Colorado doubling. Experts have linked this in part to rising fear of families who have an undocumented family member. This disproportionate lack of access to health care could explain why hospitalization rates are disproportionately high for Latinos. People who are uninsured or underinsured often delay seeking medical help until a health problem is life-threatening. Without a doubt, there are more intersecting reasons for why there is a disproportionate impact of COVID on Latinos, including access to nutritional food, gentrification, and the stress of experiencing racism. I'm sure our panelists will touch on these. But as we wrap up this section, we should touch on one demographic that has been hit the hardest in every racial and ethnic group: older adults. Older adults are generally different from other age groups physically, in contrast to, say, racial groups who have no inherent physical differences from each other. But this alone does not tell the whole story of why older adults are so hard hit by COVID-19. For example, nursing homes make up 8 of the top 15 outbreak spots in Colorado. If our society and economy were better equipped to compensate in-home caregivers, older adults would not need to be so concentrated in these facilities. If pension funds hadn't been drained over the years and fiduciary requirements of retirement advisors hadn't been loosened, retirees would have more resources to help them avoid contracting COVID. There is a long list of systemic changes that could have, and still could, lower the disproportionate impact of COVID-19 on older adults. Just like there is a long list of systemic changes that could have, and still could, lower the disproportionate impact of COVID-19 on the Latino community. This is just a quick overview of the issue at hand. There is still so much to learn about this novel virus and its impacts. Our knowledge base is evolving every day, so we rely heavily on our experts, who not only have the most up-to-date information and are working on the front lines, but also have a rich understanding of public health as a whole.
We're back. Let's get into our discussion. Roberto, I want to start with you with our first question. What are some of the causes for the disproportionate impact of COVID-19 on Hispanics and other minorities in our community?
Multiple causes, some of which were noted in the introductory video. The fact that Latinos are a young population, that they are in essential job categories where they have oftentimes been forced to work due to their industry being classified as an essential one, that they live in multi-generational households where if the employed member of the house brings back the virus, it can easily spread to other members of the household. And in the case of Denver, and I think a lot of other communities, that Latinos as well as other minorities tend to live in neighborhoods that experience environmental problems, such as pollution and industrial pollution as well, and that creates pre-existing conditions such as asthma, that when a member of the Latino community is exposed to the virus, it can complicate the disease.
Well, Evelyn, I want to go to you next, talking about your perspective as Chief Medical Officer for Valley-wide health systems. I have to imagine, as you're looking at some of the causes for the disproportionate effect, that you've seen a lot of different points there. Share with us your perspective on the same question.
Thank you. Well, Valley-wide Health Systems is a federally qualified health center, and we serve the southern region of Colorado. So we're primarily rural. So when I'm speaking from a rural perspective. I think some of the challenges that we have is we in Southern Colorado have very different Latino communities. Some communities are from the original Hispanic settlers that came here. So you tend to have an older population, the children might have moved to the city. But then you also have the migrant population or recent immigrants who are younger and tend to work in agricultural industries and also in service industries. So when you're talking about the challenges of working with this population, you have to have different approaches. Again, Hispanics have a higher rate of diabetes and obesity, which which creates a situation where there's increased risk of developing complications from COVID. They're more likely to be hospitalized with these complications.
Jonathan, I want to go to you next and get your perspective. I mean, clearly, as an assistant professor at the University of Northern Colorado, you're very near a variety of hotspots we saw come up. But with your work in Mexican American studies, what's your perspective on some of the causes of the disproportionate impact on the Latino community in Colorado?
Definitely something that has been very obvious with this crisis is that we have been living this a pandemic within another pandemic. And by that, I mean that inequity is an issue that has been affecting Black and brown folks for many, many generations. And the pandemic has made it more evident. And the current crisis that we're seeing in the health system and also in other aspects of society is just a reflection of that inequity that we need to address from multiple perspectives. It's not it's something that definitely I think it has to be at the center of new approaches. And if there's something new that can actually emerge out of these crises, is that we have to reimagine the way we deal with health crisis like this pandemic, but also inequity in every single level of society.
Jasmine, as we come to you with this question, what are some of the causes that you look at? What are some of the, let me get your perspective on what you think are some of the causes for this disproportionate impact, especially with your work as a manager of leadership programs for Voces Unidas.
We actually worked really closely with families across our valley here in the Western Slope when COVID first hit to really identify what was going on and why our rates were increasing at such a high pace. And we realized that truly we are at a disadvantage out here because we live in a news desert. We don't have any radio stations or news stations or newspapers that provide information to our families in their native tongue. And so we have this distinct disadvantage to be able to provide information to our families in a rapid pace, where they can actually receive the information and act on it on the same day. And then we also have the lack of healthcare. You know, we definitely are just seeing that a lot of families, Latino families, that are just simply unaware that COVID testing should be free. There's not any sites in their communities for free testing. And so it's really difficult if they've never visited a doctor before for them to be able to get a script to go get tested. And we're just finding that that's proven to really hinder the our population, our Latino population's ability to really control this high growing disproportionate rate of infection.
Dr. Berman, let's go to you next. I have to imagine, as the director of Denver Public Health, you have a unique look at what's going on, and I love your answer to the same question. What do you think are some of the causes of this disproportionate impact on the Latino community in Colorado?
Sure, I agree with lots of the comments from the fellow panelists. Let me just start by clarifying what the disproportion is. I just looked at data from the past week because we summarize our data on epidemiology every week. And the rate of new infections among the Latinx community is 4 times that of the white community in the past week in Denver. So that's just a clear demonstration of the magnitude of this inequity. I'd like to continue Jasmine's comment about lack of affordable health care and readily available healthcare. I think it interferes with every step in the process, from a decision about knowing that testing might be available, being able to access that testing, then being able to access care on the basis of a test, feeling comfortable sharing information with public health officials about the need to test other household members, to provide services to those people who have infection or are to be quarantined. I think we're missing at all of those steps. Another key thing I'd emphasize, and it goes along with occupation, is the frequent lack of availability of paid family leave, so that individuals who have symptoms or perhaps even proven infection aren't guaranteed time off from work, particularly paid time off from work. And that's a tremendous disincentive to follow the public health directive for this kind of infection.
I I want to get into our next level of questioning. And Emlyn, I'm going to start with you on this one. The Latino community is a wide and diverse, made up of a variety of individuals and groups, from people who have been in Colorado before Colorado was Colorado, all the way to immigrants who are recently arrived here to Colorado. And I want to start with you about the special challenges faced by immigrants in this crisis.
Well, I think they have multiple challenges. First of all, many of them don't have access to the safety net that other members of our community might have. For example, for healthcare, again, for food, for housing. They need to work because they need the income not only to provide for their families locally, but many of them send money back home to their native countries. So it can be extremely challenging for them, but they're younger. They tend to be more agricultural workers. But then we have what I call our traditional families, or descendants of our Hispanic settlers. They tend to be older. They might live alone. So the isolation that has caused for them, and then the associated depression and anxiety. This is what we're seeing a lot in our healthcare system, because their children or grandchildren can't come visit them. So it's impacted both communities, but maybe in very different ways. That is why our approach isn't one size fits all. We have to very much choose an approach that makes most sense for the community we're trying to serve.
Jonathan, as I just consider the small amount of American history that I know that recent immigrants have always been on the front lines of whatever is being faced in the nation. It seems that right now, with this pandemic facing the United States, and recent immigrants are going to be on the front lines, what other kind of special challenges are immigrants facing in this particular crisis?
And I think that one of the main challenges, and that was something that was addressed by the other panelists, is having access to testing. We have to remove the fear of getting tested. One of the main things many of these immigrant communities or immigrant families are thinking about when they're thinking about the possibility of contracting COVID-19 is that they might lose their jobs. So they're more reluctant to go and get tested on a more frequently basis. So we have to really develop a campaign that is bilingual, bicultural, and it's really a reflection of these communities. So we can demystify a little bit this process of getting tested. In addition to that, we have to address, this is a crisis that intersects with other issues that are affecting Latinos, but affordable housing is such a big deal. For example, here at UNC, I came across different students who actually ended up working additional jobs over the summer to help their families just keep their house and maintain the house because their parents ended up losing their jobs, and they had to expose themselves even more to the virus during the summer. So immigrant families, I agree with the rest of the panelists, when we look at the Latino population in the state of Colorado, we have to develop different strategies to, number one, educate them, and also empower them to make the best decisions for their families in this moment and this period of a crisis.
Jasmine, I'm very interested to hear your perspective because of your work on the Western Slope, and frankly, because the wide variety of communities. And sometimes I think it's easy for folks in the Front Range to take that for granted. We go to the store and see Olathe sweet corn or Palisade peaches, but there are a lot of people in a lot of different communities making that happen on the Western Slope. From what you've seen, what are some of the special challenges immigrants are facing?
Yeah, out here in Garfield County, where I reside, my family resides, we are actually 5.3 times more likely to test positive than non-Latino, non-Hispanic residents. And so, to really see that we are just disproportionately being impacted just in the county where we are 30% of the population, but 75% of the cases of COVID you really just can see firsthand how all of our population is being affected, just truly by lack of information, lack of housing, lack of transportation. I think the counties have done a better job than when COVID first hit in providing information in Spanish on their public spaces, like, their Facebook pages. But it truly is still just a lack of trust, lack of communication from both the county and we feel like just really the any local government that whether it's the city or the county, to be providing information to our population that is in their native tongue, that is up to date, that is in real time, so that we don't have to have community members translating it for the rest of the community. And I think that fear is really real in this community where we don't feel valued or wanted. And I think that leads to a lot of mistrust when, we get calls from public health that want our information of where we've been and where we work, because they don't want to help us, but they also want our information. And, it's really hard to feel like we belong here.
Dr. Berman, when we look at Denver Public Health, they are here for the entire community. You have to look at everybody, but certainly a strong immigrant community here in Denver. What are some of the special challenges you're seeing facing immigrants here in Denver?
Oh, I think people have already mentioned a number of the challenges. There are many. I'd turn then to what we can do about it. And a basic strategy we've adopted is that we need to have things like better bilingual, but we need to really emphasize the bicultural part. It makes a complete difference if the person who's calling you to say you may have COVID comes from your culture and just is not able to speak Spanish. So we're working with community-based organizations to really get information out in a way that's in addition to what comes out in formal ways on the internet or through news media. So the information gets out through trusted people within the community so that the phone calls come from people who come. We're hiring from the community to do those jobs like case investigation and contact tracing. So it's just a basic strategy. We need to work with trusted members of the community to repair some of these understandable lack of trust with government, with medical care organizations. That's just a critical strategy for us.
Roberto, let's go to you to wrap this up on this particular question. What are some of the other aspects about the special challenges facing immigrants that we need to keep in mind?
Well, I agree with a number of the points that other speakers have raised, and just want to reemphasize the issue of trust and fear within the immigrant community, that we are living in a situation where oftentimes the community is stigmatized and feels like it's under siege from parts of some elected officials. And that does raise issues of trust. A lot of times the community is objectively not able to access the safety net that other members of our community can access. And that fear makes it so that even when they can access parts of the safety net, they choose not to.
Jonathan, I want to start with you with our next question because I think as an assistant professor at University of Northern Colorado, you run into a lot of young people of all types. But from the studies we've seen, the Hispanic community is younger and overall as a population. Does that have a particular effect when facing a crisis like the pandemic?
Definitely, I started to see the changes early on when the pandemic hit us. There was a lot of misinformation circulating, and especially by our local authorities about that the only groups that were being affected by the COVID-19 were older groups, right, 60 and over, and people with preconditions. And this misinformation, unfortunately, early on started sending the wrong message to some of our Latino young members of a community. I think that after there was a strong campaign led by state officials to promote the wearing of masks in public and social distancing, I think that many of our students started to get educated more about it. In addition to that, I think many institutions of higher education have been promoting this important culture of mutual care and responsibility as a way of protecting not just our own health, but also protecting the health of other members of our community. And I think that that's having a positive effect, but still a lot of work to be done to continue promoting these practices in all of our campus, but also outside our campuses in our daily activities.
Jasmine, I'm also assuming that you work with a lot of young people, probably people of all ages in the Western Slope, but specifically, I know early on in this pandemic, young people from all backgrounds probably felt a little bulletproof, that this was just a problem for older people, but we've seen that it is really across the board, especially as people interact with each other. What are some of the things that you're seeing as an impact with the younger community, the overall youth of Latino community, especially as we look across the state of Colorado?
Well, we have the opportunity here in the Valley to have tourists come in year round, and so I think for us, we have a lot of those new immigrants that just arrived. Some of them before the pandemic hit, and then we have families that have been established here for years and have decades of family members, but like others have said on the panel, they live in generational households. And so, as much as we attempted in our city to say, we had to enforce the mask ordinance, a lot of the employees that continue to work, whether it was construction, hospitality, the restaurants, or just really in that tourism space, they still traveled up towards Aspen. And so there are a lot of little cities as they drive up or that they may reside in that didn't enforce the mask ordinance. And so I think for our community, we definitely saw a lot of our older generation being impacted because they couldn't be quarantined or isolated from their extended family because they live with them. And then we also had some abandonment going on with our older population, where it just really possibly because they wanted to protect their father or mother or grandparent, they just quit visiting them to protect them. And then also some of them who just had to go back home to whatever country they came from because it just was too difficult to be able to provide or have any income since nobody in the family qualified. And so I think we're seeing a huge disparity of really concerning cases in our valley, whether it's young or old. We definitely have a huge impact to the Latino community here.
Dr. Berman, what are you seeing as some of the effects of an overall younger community within the Latino community in Colorado and Denver? How is that impacting some of the work you're seeing?
Yeah, the additional theme that I bring up is we're working very closely with school districts around the metro area, and particularly Denver Public Schools, and to try to assist them in reopening schools in a safe way and at a safe time. And as we've done that, we've looked at the diagnosis of COVID-19 among school-aged children and youth, and it's really striking. So over 80% of the cases of COVID-19 that have occurred over the summer, obviously when school wasn't in session, were among kids from the Latinx community. So what that says to us isn't all that surprising, but it's critical because it tells us we need to work very hard at getting testing available, readily available, so that kids can be evaluated quickly, so that appropriate decisions can be made about individual kids, their families, and then importantly, appropriate decisions can be made about classes and schools. So that's one of the major areas of focus for us right now.
Roberto, I know your work with AARP Colorado brings you with, maybe might start with a focus on a particular generation, but eventually it gets into a lot of multi-generation conversations. And when we look at the overall youth Latino community, how is it impacting some of the things you're seeing?
Well, at AARP, our membership starts at 50 years of age, so we're concerned with a lot of working age members of the community and their families. As we noted, Latinos live in multi-generational families. A concern that we have is that although due to their youth, Latinos don't experience death as a result of the COVID infections at anywhere near the rate, the disproportionate rate that they experience the disease, that emerging evidence has indicated that people that go through COVID, even if they don't require hospitalization, can still have lifelong health consequences. So that's one concern. The other concern, especially with public schools opening, is that with a large number of children and families, the issue of those children bringing the virus back to their household, in addition to the fact that a recent CDC study has indicated that although children do not experience complications, some of them do, and apparently minority children, especially Latino children, have experienced the complications, the health complications, at a rate that is 8 times higher than the general population.
Emlyn, I want to go to you to wrap up this question. As you're looking at the overall youth of the Latino community, how is it impacting some of the things that you are seeing?
Well, again, in a rural community, it's a little bit different. When we look at the number of cases that we were testing locally, most of the people who got tested were between the ages of 20 and 60, and 32% of those that were positive were Hispanic. So we know it's very much circulating in our young population. What I do want to say, though, is I was in a roundtable session in Center last week. Now, Center was one of the communities that had an outbreak. And what they did was they just got together as a community and they talked about, getting promotoras, which are healthcare workers that spoke the language of the community, so they can explain not only about testing, but what results mean. So, and then how is it that how we use contact tracers to contact families when they're positive, and what that means in terms of isolation. I agree with one of the previous panelists that it has been really confusing with the information changing all the time and really trying to communicate to our communities. But I think the language challenge for some of our monolingual speakers, especially when they're navigating in a healthcare system that mostly speaks English, has been very challenging, even our younger folks. So again, I see it did very much impact our younger community, but on the other hand, a lot of them have been very compliant with using masks and really trying to isolate their families when they've tested positive.
Let's turn now to what governments and community organizations are doing to address the problems we've been talking about. Jasmine, I want to start with you and what you're seeing, whether it be a community organization or governments, be it local, state, or national. What are some of the steps that you are seeing that are helping to address all the different issues we've been talking about today?
Yeah, so Voces Unidas actually was created 4 months ago out of response of COVID. We really had connected as a Latino network and had been in conversations about all the different things happening in our community. But when COVID hit, we really saw the urgency for us to become the first Latino-led, Latino-created for Latinos nonprofit in our community. And so we represent the Aspen to Parachute and the surrounding areas and communities. And really what we've done on our end is really advocate for actually bilingual and bicultural communication going out in real time, up to date, and really just making sure that we are being, we're 30% of the population in Garfield County, 30% of the population in Eagle County, 10% of the population in Pickens County, and we typically get the last and or maybe like 2 days late news. And so we've been really trying to advocate and hold our leadership accountable to say we need information in real time and we shouldn't be the ones translating it for the rest of our community members. And, you know, on our end, we did receive a donation from some generous donors of over 12,000 PPE masks that we were able to give out during our food distribution. Food equity is such a huge, I mean, food insecurity is such a huge issue out here in the Western Slope. And so we have been working with Food Bank of the Rockies to distribute food to our Latino population. And so we were able to hand out more than 10,000 PPE masks for our families that were coming to pick up food boxes. And we just really want to advocate for our families that work in the restaurant, construction, retail, hospitality, that, you know, even if their employers maybe don't protect them to the full extent that they should, that we care and we're here to help them get through this.
Dr. Berman, you're right in the middle of everything that's happening in Denver. What are some of the steps that you're seeing, whether it be by governments or community organizations, that are helping to address the issue?
Yeah, I guess the first thing I've made is that I think the ideal situation is a partnership between governments and community-based organizations. I work in a quasi-governmental organization, and we're a big organization, and we know that has strengths and we know it has real weaknesses. And so a fundamental principle we bring is that we need to work with community-based organizations that have much more detailed knowledge of the community, better ability to communicate effectively. So just an initial point to make. We start with testing. So can we expand testing to high-burden neighborhoods? And those are particularly Hispanic neighborhoods in Denver. So we work with community-based organizations to put on testing events in high-burden community. We work with family health centers to provide expanded testing in those same neighborhoods. So really starting with testing. And then for those people who test positive, giving a much more expanded set of services, not just a phone call that says your test is positive, but a phone call that says your test is positive and how can we help you? How can we help you isolate safely in your home? Can we provide PPE? Can we provide food assistance, economic assistance? Can we help you get other members of the household tested? We're starting next week with a program in partnership with a group of promotoras where we'll do home visits to provide some of those services. So that's the second part, is much better services to the individual who's just been told that they're positive. And then a handoff to the medical care system where we can promote individuals getting quickly from a diagnosis into the appropriate level of care so that we can prevent these late presentations with severe disease to the hospital that really result in a lot of the morbidity and mortality of the disease. So that's some of the things we're working on.
Roberto, I know the AARP works with a lot of different community organizations really across the country, but here in Colorado, what are some of the steps that you're seeing that are helping to address the pandemic?
Well, I think we've heard from a number of the organizations represented on the panel on the work that they're doing, the food pantries. I think the work of community clinics such as Valley-wide are an important component of that needs to be supported both by government and non-governmental foundations and organizations, because they are a key part of the response, in particular in addressing the needs of the immigrant community. For AARP, the defense and and advocacy for the expansion of Medicaid is an important goal that we undertake both in Colorado and across the country. I would say that there is also a need to ensure that existing regulations that protect essential workers in industries such as meat packing and farm work are truly enforced, so that those workers receive the protection they're entitled to.
Emlyn, I have to believe as a chief medical officer, you have seen a lot of the different steps, whether it be by governments or community organizations, really everything in between. What are some of the most valuable ones that you feel are really doing everything they can to address the problems that we've been talking about during our discussion?
Well, I'll speak about Valley-wide, and what we did initially when the pandemic started We knew that people were afraid to come into our clinics because they were afraid of exposure. So we implemented telehealth fairly quickly. This means that we could do visits with our patients over telephone or virtually. So that was really appreciated, especially by our elderly populations. We have a mobile unit, and we've been collaborating with public health very closely since beginning about setting up testing sites, especially in areas where we had outbreaks. They were primarily in our agricultural areas. Of course, we have a huge mushroom plant here. We have potato warehouses. And so we were able to, when cases were identified and an outbreak were starting, our staff and also public health, we went out and we tested people in their vehicles. We have a community care clinic that offers testing 7 days a week. And we also are testing out in the Arkansas Valley, and we've started to test in Canyon City. So that is the beauty of a rural community. Excuse me, we tend to work very closely together because we're small. We have a pretty good network. But what we heard from our patients, and what was really important for us, is that we stay connected with our patients, even when people were quarantined or told to stay home. So again, it's been really an opportunity for us to look at new ways of how to deliver healthcare, how to address outbreaks fairly quickly. The contact tracing that we're going to start being involved in is going to be very important. And I would like to mention that when we're speaking with our families, we need to have staff that speaks their language and understands their culture and some of the challenges they have in order for them to be effective. So the outreach portion of what we're doing is very important.
Jonathan, I have to believe with your work at the University of Northern Colorado, you're seeing, again, like we talked about here, a lot of community organizations, a lot of government work, whether it be from local, state, or even national levels, come together. What are some of the steps that you're seeing that have been effective at any level addressing the pandemic?
Definitely the state mandate of encouraging people to be wearing a mask in public. I think that message has been very effective. Now we see more Latino, Latinx members in the community wearing a mask and knowing the importance of taking care of themselves and also taking care of others while doing this. Another aspect that we're currently working on, something that many of you probably already know, but meatpacking workers were early on affected by this pandemic and continue to face difficult work conditions as we are going through this COVID-19 crisis. And that's something that inspired a lot of us, a lot of my colleagues in our program, to do something about it. And what we have been working on is on a campaign to promote and distribute masks in the community. In partnership with AARP, that's another institutions and organizations in the community. Our goal is to continue pushing for this message and making sure that our community is aware that this is far from over. We need to be on the defensive mode, making sure we're taking care of each other and go through this together as a community. And this is something that we're going to be doing in the fall. And what I really enjoy is to see our students being inspired by this and seeing themselves as real agents of change by being involved in the community, which speaks a lot about the history of programs in Mexican American studies, Chicano, Latinx studies in the United States.
Well, as I've warned everybody on specials like this, an hour goes by very quickly. And as it has again here, we just have a handful of minutes left. I want to get everyone's final take on this, basically giving everybody about a minute to give us their take on additional steps needed to happen, whether it be local community organizations, governments, whatever it is. What other steps need to happen, and maybe why you're optimistic that our community can come together to really address these issues. So everyone taking about a minute apiece. Dr. Berman, I want to start with you with your comments about what other things need to happen and why you're hopeful, or hopefully you're hopeful, that we can do this as a community.
Well, to start with, I am hopeful. I think we can do it as a community, so thanks. I guess the additional thing I'd bring up in the short term is vaccination. So we need to make this the year in which we achieve record vaccination rates for influenza. Traditionally, we do no better than 50% of the population, and we have to do better this year at preventing influenza because a surge of influenza-related illnesses, hospitalizations, and deaths is the last thing we need in the middle of the COVID epidemic. So that's number one. There's an additional vaccine issue that's not so far off, and that's having a vaccine against COVID. And we think that's probably within the next 6 months. We need to make sure when those vaccines, it'll probably be plural, multiple vaccines, when they come out, that they get distributed in an equitable way and do so rapidly. And so we're working on those plans now for how can we work with communities to build the trust that vaccines are safe, that they're a critical weapon in our arsenal against COVID, and then assure that there is equitable opportunity to get those vaccines. In a longer term sense, the thing I look for is, can we translate some of these innovations that have occurred in the midst of this pandemic into long-term interventions in our community? And a number of them have been brought up already. So the use of telehealth, it's been great for patients, great for providers. It makes total sense. We need to institutionalize that practice. Bringing more community members into our systems of public health, of medical care, is something that's an innovation that's happening in the midst of the COVID epidemic. We need to make that long term. And so in a number of ways, how do we translate the innovations that have been done in the midst of this pandemic into long-term policy changes that benefit our community?
Roberto, let's go for you for your closing comments.
Well, we feel that a response involving all sectors of society is important, but within that, the role of government, we feel, is key at all levels: federal, state, county, and municipal government. We're lucky that we live in Colorado and that our local government has, by and large, done a very good job of being proactive in this crisis. But we're also lucky that we are coming into an election, and we really, as AARP, urge all people that can vote to participate, become informed, become engaged, and make their voice heard regarding what they feel is the appropriate response that they expect from their elected representatives. And if you are not registered to vote and can do so, you can easily do that in our state by going to the Secretary of State's website and very quickly register to vote. So that is our primary focus at this point, encouraging our members, their families, and the community to use their franchise and make their voice heard in addressing this crisis.
Emlyn, as time is running out, give us your 30 seconds, closing comments, what you think needs to happen.
Well, I think what we need to do is, I definitely with Dr. Berman agree about immunizations, especially the influenza vaccine. We really need to get out there and start immunizing people. But I think it's very important that we dispel myths and misinformation that is out there about COVID and why is it important that you protect yourself. On the other hand, one of the other consequences of the pandemic has again created a lot of isolation and despair amongst a lot of people. We see, as I mentioned before, some anxiety and depression. So we have to remember that there is a psychological impact from this pandemic and how it has made people fearful and have, again, the isolation, especially in our elderly population, has really affected them. So we always should remember that piece as well. But again, I'm very hopeful when we get our COVID immunization that things will start to go back to normal, but that they won't ever be the same. And hopefully we're all better for it.
Jonathan, let me get your 30-second closing comment.
Definitely, I agree with all the comments from the rest of the panelists. I think that all those points are very valid, and we need to make sure that we continue to implementing them in the following years and carry on the same type of work to address this issue of inequity that we see in communities of color, and it's particularly in the Latinx community. I also want to stress the importance of collaborating, and I think that's something that I've seen in the community, and that is very promising. And I hope that we can continue collaborating across the state and across the nation. Whatever is working, why don't we try it here, or vice versa? Take that to another state or another region to see how can we confront this pandemic, but also how can we erase inequity, which is something that has affected Latinx communities for a long time.
And Jasmine, your closing thoughts.
Thank you. Yeah, I think this pandemic really highlighted the inequities that existed in our communities long before COVID hit. I think it really highlighted for our city and county governments that they really needed to be staffed with Spanish-speaking, bicultural, bilingual employees that could provide not only communication, but assistance to the Latino families that reside and pay taxes here in our communities. And I'm really hopeful that the county and the local government will continue to employ and to see the value of having Latino employees and really bridging that gap that has existed for far too long in our communities. I also think that the promotoras are a great idea, and I do know that some of our counties have started using that idea here, or at least attempting to, and so I look forward to seeing that hopefully come to fruition here in our communities. And I think for the state and for our city and county governments to not forget that there are a lot of families that still need economic assistance and also are still struggling with food insecurity. And so I know COVID feels like it's been here for a very long time, but we have far too many families still still experiencing homelessness, still experiencing evictions and food insecurity, and are really just needing help from the communities that they reside in. And so I hope that the county, city, and state don't forget that, we still need assistance in our communities, especially in the rural.
Well, that is all the time we have for our special look at the impact of the COVID-19 crisis on the Latino community. I'd like to thank our esteemed panel for their insight. I also want to thank all of you for tuning in. We have learned that to be effective, a global response involving individual responsibility, community institutions, and governments are necessary. We have also learned that what governments at local, state, and national levels do or fail to do is critical. This is an important lesson to keep in mind as we head into the decisions that we all will make this fall. For more information on what you've seen tonight, please go to AARP.org. On behalf of everyone here involved in making this special reality, I'm Dominic Dezzutti. Thank you so much for watching. Good night.